Osteoporosis is a bone disease that occurs when the bone loses too much bone, makes too little bone, or both. As a result, bones become weak and they may break from a fall, or in a serious case, from even sneezing or minor bumps. Osteoporosis means porous bone. When viewed under a microscope, healthy bone looks like a honeycomb. When osteoporosis occurs, the holes and spaces in the honeycomb are much larger than in healthy bone. Osteoporotic bones have lost density or mass, and they contain abnormal tissue structure. As bones become less dense, they weaken and they're more likely to break. pH and the acidosis cycle. Metabolic acidosis can lead to a loss of bone in your body. A link has been shown between the consumption of pasteurized milk and its increase in osteoporosis. This may seem counterintuitive as milk contains calcium. However, the acidic environment that pasteurized milk creates can cause a state of acidosis, and this in turn can leach calcium from your bones in order to buffer your pH. Interestingly, raw milk, which is full of enzymes, has the opposite effect and can be very beneficial to patients who are experiencing osteoporosis. In vitro studies demonstrated that osteoclasts, the bone cells that dissolve bone, are activated at a low pH of around 7, and they become progressively less active as the pH approaches 7.4. This is one reason to adopt an alkaline diet when trying to deal with osteoporosis. Vitamin D helps the body absorb calcium and phosphorus from the food that you eat. So this nutrient is important for people with osteoporosis. Studies show that calcium and vitamin D together can build stronger bones in women after the menopause. It also helps with other disorders that cause weak bones, like rickets. In order to assess your vitamin D levels, you can get a 25-hydroxy vitamin D blood test and then supplement accordingly. Vitamin D works synergistically when taken with vitamin K2. Vitamin K2 appears to protect bones more than vitamin K1, and too little of it is bad for your bones. Studies have shown that poor vitamin K intake is linked to low bone mass, osteoporosis, and increasing your risk of fractures. Women who consumed less than 100 micrograms of vitamin K per day were found to be more likely to break a hip. Any more than 300 micrograms of vitamin K2 cannot be absorbed, so that would be the maximum daily dose. You can see the work of Dr. Weston Price and his study of vitamin K2, which he labelled Activator X, for more information about all the benefits from K2. MSM has potential to be used as a therapeutic agent to treat bone-depleting conditions such as osteoporosis, where the mineralization of bone is impaired due to the decreased osteoblast differentiation. MSM is a form of sulfur which can have many benefits for the body, particularly in relation to osteoporosis. It also helps to balance the pH. Doses can be up to 30 grams per day. However, this dose should be built up to slowly, as many can experience detoxification symptoms when they first start taking MSM. Taking MSM with vitamin C can help to reduce this detoxification, as vitamin C has the ability to bind to toxins easily and help them get removed from the body. Vitamin C is widely known as a powerful antioxidant, as well as an effective cell protector and immunity booster. But supplements of vitamin C have recently been recognized as having an important role in the prevention and the treatment of osteoporosis because of its ability to increase bone density. The best forms of oral vitamin C are firstly liposomal vitamin C, then non-acidic forms of vitamin C, with the worst kind of vitamin C being ascorbic acid due to its ability to cause stomach upset and its highly acidic nature, which would be detrimental in the case of osteoporosis. Collagen is the most abundant protein in the human body. It's found in bones, muscle, skin, and tendons. It's the substance that holds the body together. Collagen forms a scaffold to provide strength and structure. Hydrolyzed collagen has a positive therapeutic effect on osteoporosis and osteoarthritis, with a potential increase in bone mineral density and a protective effect on articular cartilage, and especially in the symptomatic relief of pain. Doses can range from 5 up to 30 grams per day, and it can be sourced from fish or animals. Hyaluronic acid is well known for its skin benefits, especially alleviating dry skin, reducing the appearance of fine lines and wrinkles, and speeding up wound healing. It can also help relieve joint pain in people with osteoarthritis. New animal research has begun to investigate the effects of hyaluronic acid supplements on bone health. 2 studies have found that hyaluronic acid supplements can help to slow the rate of bone loss in rats with osteopenia, which is the beginning stage of bone loss that precedes osteoporosis. Doses of 240 milligrams per day for at least a month have been shown to significantly increase skin moisture and reduce dry skin in adults, so this may also be a good starting dose for osteoporosis. Deer antler velvet is a natural substance that contains over 300 bioavailable substances, and it may be beneficial for osteoporosis. Some researchers believe that velvet antler may have the ability to rebuild bone in people with degenerative diseases. Velvet antler is rich in calcium and phosphates. It's an extremely fast-growing tissue comprised of fibroblasts, chondroblasts, and chondrocytes, which are required for healthy growing bone and tissue. And new research also suggests that deer antler may help cure debilitating bone diseases like osteoporosis. Typical doses start at 500 milligrams of deer antler powder twice per day, but can be much higher. Don't purchase antler in the form of an IGF extract spray, as it's not useful in this case. Royal jelly is harvested from beehives, and it's sold as a supplement in skin creams to enhance collagen production, to ease premenstrual and postmenopausal symptoms, and improve overall health. Royal jelly and bee pollen decrease the bone loss due to osteoporosis in a rat model. These results may translate into human osteoporosis cases also. Growth hormone continued to reduce the risk of fractures and help maintain bone density in postmenopausal women who had osteoporosis, according to a new study published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. Some ways to increase growth hormone are by using melatonin for sleep, intermittent fasting, high-intensity interval training, or the research chemical MK677 that gets dosed at 12.5 milligrams per day has been showing promising results in trials. There's also a relationship between growth hormone and blood sugar, therefore blood sugar management should be taken into account with this. Also, sugar is considered highly acidic, therefore blood sugar should be managed in osteoporosis cases anyway. You can check out my other video on blood sugar for more information. Strontium has been prescribed in Europe for years to promote healthy bone aging. Strontium is a trace mineral whose metabolism is closely linked to that of calcium. It resembles calcium at the molecular level. Strontium concentrates in the skeletal system, where it plays a key role in supporting bone tissue density. Typical doses are 750 milligrams per day of strontium in the form of strontium citrate. There can be an over-reliance on hype regarding high calcium doses for osteoporosis. However, this can be dangerous if there isn't sufficient magnesium in the diet. Magnesium deficiency contributes to osteoporosis directly by acting on crystal formation and bone cells, and indirectly by impacting on the secretion of the activity of parathyroid hormone and by promoting low-grade inflammation. The best form of magnesium is magnesium bisglycinate. In order to determine your dose, slowly increase until side effects of stomach discomfort or diarrhea are noticed. Then slowly reduce until these side effects disappear. This allows you to determine your optimal daily dose. As magnesium is required by the body for proper functioning of hundreds of enzymes, profound results may be noted in all areas of your health after a few months of use. Unless you can source raw milk, I wouldn't choose dairy as a calcium source for osteoporosis. Also, synthetic calcium supplements would not be recommended. There are, however, many natural healthy foods that contain calcium that's bioavailable, as can be seen in this photo. Heavy alcohol use also increases a person's risk of developing osteoporosis, and there are many effects of alcohol on bones and joints, such as causing them to become more brittle. Some experimental research chemicals. Studies provide the first evidence of the ability of SARMs, selective androgen receptor modulators, to prevent bone loss and improve bone strength in females, and suggest that SARMs can hold great promise for the treatment of osteoporosis in both men and women. You can see my other video on why people are turning to SARMs for more information about these compounds.